That's great. You just looked yourself in the camera and got recorded.
Big ass lens right there. My name is Dr. Michelle Gengler, and I am a small animal veterinarian. I am a small animal general practitioner. I do own it is an independent small animal hospital in a small town northeast of Seattle. In my opinion, it is important to continue to have independent veterinary hospitals so that we have individuality and uniqueness within the field, but also there's a lot of cookie cutter medicine, and for me, as the term goes, this is the practice of medicine. Within the field of medicine, there's a lot of different ways to do things, and I found when I worked in corporate medicine that general guidelines can be helpful, but following a direct script does not work for every single case and every single client, and certainly not for every single patient. And for the individual doctor, I feel it's important that we maintain what's important to us and in our hearts, and I don't think corporations have that in mind. I think they treat doctors and clients and definitely patients like a number. And I know many people have heard treat them and street them, and there are some corporate practices that do that. Unfortunately, there are practices all over the place that do that, but independent practice owners have a bigger heart, and we're able to do different things. If I want to buy lunch for all my staff on a Tuesday, because we've been rocking it, I'm going to do that. If I want to stop and pick up breakfast or coffees, or if I want to decide that we're going to have a cartoon scrub day, then we can wear cartoon scrubs. If I want to go to work wearing something that I'm comfortable in, that my clients are comfortable seeing me in, and that I'm able to do my job efficiently and effectively in, I'm going to wear that. So I wear scrubs and jeans, and I don't have to worry about expensive clothing. My patients are not as afraid of me, and I reduce the overall fear and anxiety in the hospital when they come see me. There's so many different aspects. I can't answer it in one question in one setting. With an independent hospital versus a corporate hospital?
Yeah.
I think that depends on the person.
Okay.
That depends on the doctor's communication style. That depends on the client and what type of client you have. Some people want to come in and get it done and go. Some people want to visit because their pets are the most important thing to them. You've got to work with your client, and you've got to understand how they see that cat or dog or whatever patient is brought in. And being an independent practice owner, I'm able to take a little bit more time, and I can understand that relationship and work on my treatment plan, work on my conversation style, work on our interaction so that the client feels most comfortable. It's terrifying, and it breaks my heart. It's scary. It's obviously very emotional, and I think that even though we keep talking about it, we're talking around it. And as much as we try to bring awareness to it, ultimately, until people in general treat each other with respect, I don't know that anything's going to make a difference. Because, unfortunately, veterinarians get beat down a lot. It's an emotional profession, perhaps more so for me, because I get so involved with my patients and their lives. But to have someone come in and accuse me of only being in it for the money, or to say things like, if you really cared, you'd do this for free. I can't do it for free. I have to be able to put gas in my car. I have to be able to pay my mortgage. I actually have to be able to pay my staff a living wage, and I have to pay the electric bill. There are things that I have to do. I'm not just walking in the room and slapping down some bill. These are the things that I feel are best for the patient based on my education and my knowledge. And if I'm able to conduct a thorough examination in a shorter amount of time and assess what's going on, the cost of that examination is paying for my education and my knowledge and my skills and my 20 years in the field as a technician and a doctor to assess what's happening and work with the patient to figure it out. It's emotionally, physically, and ethically taxing to have individuals, even once every 6 months, lash out. And there are those few that lash out because they're hurting. And I understand that. And those kinds of things we can work through. But then there are those people that are just vindictive and didn't plan, so they're angry and they blame those of us in the veterinary field. And it's not our fault. That's too broad of a question. You've got to narrow it down. Okay. Because every day I'm providing education to my clients, to my community, to the Facebook world and the Instagram world and everywhere else, just with general posts that I do. Whether they're funny posts or whether I'm posting a picture of a surgery or whether I'm posting a picture of a bottle of worms. Openly or short and sweet? That's hard because I think for a lot of us, generalizing, I think we would say stop the BS, get over it, and accept the fact that you have a pet, and when you got a pet, you accepted responsibility for that pet, and that means feeding it and caring for it financially. And as much as I think it would be wonderful to everyone to have a pet, sometimes you have to realize that it may not be the best time in your life, financially or time-wise, to have a pet. They cost money. They do. Even just for a good diet, they cost money. Not even thinking about those pets that have chronic health conditions, or the dog that eats 47 pairs of socks or gets into the garbage can and eats all the diapers. There's things that happen that cost money. There are accidents that you can't plan for that cost money. And it is not the individuals in the veterinary community's fault or responsibility to cover that financial burden. It is our responsibility to medically assess what's going on and provide the best treatment for the animal for the best outcome. Basically so that they live and go on to dig holes and trample each other in the yard and play with their bones and their toys. I don't know that, again, always speaking in generality, I don't know that people understand how much some veterinarians take home with us. I feel every birth and death, but the deaths, I feel every death significantly. I feel every why are you asking me this? I feel every euthanasia, everyone. And everyone, it breaks off and takes a piece of my heart. It just does. And there are some that just really hit me harder than others. And I mean, Friday, a longtime client had stopped in and dropped off some medication to donate, and we euthanized her dog over a year ago. And I just broke down when I heard that she came in, because she and her children and her dog were just really special, and there's just a lot of emotion in this field for me. But it's hard to have people say things. For example, I had one person say, "I can't believe you're going to charge me for killing my cat." Well, I don't see it as that type of procedure, because the patient was elderly and very ill, and it was time for her to transition. And that's a really harsh thing to say in the room. And I know some doctors that would have said, "Get out, I'm done, I'm not helping you." And I know other doctors that would have just broken down and said, "I can't do anything for you right now, that's awful." And I, whether it be because I'm the owner and I have to keep my cool, whether it's because I understand that this particular woman was incredibly emotional and there's a lot going on in her life, and I tend to try and put the entire pieces of the puzzle, all the pieces of the puzzle together. I don't know. Maybe my background in psychology and social work come into play. I had to just bypass that comment, say things like, "Well, it's time, she's ready," and gently talk about the fees. I cannot do certain procedures for free. And strangely, within this particular appointment, this went back and forth. One minute it's, "I can't believe you're going to kill my cat and charge me for it," and the next minute it's, "Thank you so much for fitting us in and helping us." That was a really hard one, because it just went back and forth and back and forth and back and forth. And in this 30-minute time frame, while I'm trying to help this suffering pet that really should have left us before she came in to see me, I have to do what I know is best for the pet and deal with what is emotional abuse coming from this client. There's just stuff that happens. There's a lot that we take on that we are expected to deal with, and I am starting to not deal with it anymore. And whether that be me just standing up for myself more as a woman, or whether it's just me standing up more for myself as a doctor in this field and doing what I feel is ethically appropriate, I have to protect myself and my heart. because I have to come home to this nut and all the rest of it. To my kids, my husband, and my house full of critters that need me as well. That's a hornet's nest. Patients need prescriptions. Some clients realize that veterinary hospitals are, or at least mine, is a one-stop shop. So we are the doctor's office where, where you do routine things. Vaccinations, deworming, parasite prevention, and do you need to fill your prescription? You can do that with me. I have an in-house pharmacy. Do you need to have a surgical procedure done? Most surgical procedures I do in-house. Do you need to have a dental procedure done for your pet? I do almost all dental procedures in-house. So my hospital is a one-stop shop. I'll do anything but orthopedic procedures. Online pharmacies. It's tricky because everyone shops, we all price shop. Whether we go to Costco because it's cheaper to get the 4,000 pack of toilet paper, or whether we order from Amazon because we know we can get the 64 pack of markers there for a lower cost than going to Office Depot. We all price shop every day in our own lives. With health care for your pet, I would caution you if you price shop, because you get what you pay for. So online pharmacies. Everybody wants to find a lower cost. And I realize you've got to work within certain budgets. You've got a car payment due, you've got rent due, you've got your own health bills, whatever it is. If you look at flea prevention, something simple, prescription medication, if you're ordering it from me and you're buying it from me in my hospital, one, you're getting it directly from the distributor, so we know where it's coming from. It's not being rerouted or sitting in a warehouse or something like that, so it's not being subjected to high or low temperatures. We know that it is not counterfeit product. If you are ordering the product and purchasing it from me or my extended pharmacy, which is now, there's an available pharmacy online, you are supporting an independent small business. You are supporting my staff. You're supporting the fact that my employees get paid vacation. My employees have a retirement package with a match. You are supporting things like I took all of my staff on an outing and we went and did an escape room. We're planning a summer barbecue where we're gonna just grill and hang out and play, horseshoes or badminton or whatever the heck it is we're gonna do, and just do some things together outside of work without the phone ringing and the doorbell ringing and everything else going on, where we can just kind of sit and chill together. The stuff you guys like to do when you're at home, hanging out with your friends and family. But you're also supporting my ability to not only pay the electric bill and the phone bill and purchase better chairs for my exam rooms, I can now go once a month and swing by the local coffee shop supporting another small business in town and buy everybody in my hospital, which could be 6 people, which could be 12 people, depending on the day, all of my staff, their own coffee or morning beverage of their choice. I can bring in fruit and bagels in the morning. I can buy everybody pizza for lunch. We can have a staff meeting that actually consists of supper so that we can do something entertaining and relax and learn at the same time. You are supporting the team, the community, and the individuals by buying the product from me. Might be about $5 more expensive, could be $9 more expensive, but what you're getting is so much more important than that. They're gone. So it's kind of a bad, I suppose a bad joke, but people in the veterinary community can drink. But the other part of it is veterinary staff like treats. Whether it's a vegetable tray or a plate of cookies or, I mean, a box of granola bars, you would not believe how quickly it goes away as soon as it's brought in. As soon as something hits that counter, the first thing that's said is, "Oh my gosh, who's this from?" Then there's a little discussion of the pet and who it is and what happened the last time they were in, and then you blink and the counter is empty. It's all gone. We're usually running around working like crazy, so bathroom breaks and food breaks, we take them as soon as we can get them, and if there's something lovely on the counter, we grab that in between rooms and visits. We always love it when people say thank you. We always love it when people tell us they appreciate us. I mean, I'm a hugger. My clients know that. So it's very rewarding to us, to me, but I know that I probably hear it. I don't hear it very often, but when I do, I hear it more than my staff does. So if you have something to say to your veterinarian or your veterinary staff, thanks for the bandana, or did you know that when we turn the corner and we're on our way to the clinic that my dog barks and can't wait to get out the door? Anything like that, it makes our day. So tell us.